Hello guys, vanakkam and welcome to Indian Nursing Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and OET training. We were discussing Sri Chitra Tirunal Institute of Medical Science Nursing Officer Recruitment Exam question paper. Already part 1 is there in the Indian Nursing Academy YouTube channel. I will be giving the link in the description. Kindly watch it by clicking the link. In the continuation of that, we are going to start with the 26th question. Already 25 questions we already discussed along with the rational, and today we are going to start with 26th question. So watch the video till the end. It will be so much useful for you for the upcoming examinations. So the question is, the nurse assists a patient in connecting the stressful event with the patient reaction is known as. So here a nurse is helping the patient to connect the stressful event and the patient reaction to the event. So these are all the keywords. Already the patient would have been undergone some stressful event and the nurse is helping to connect the stressful event to the patient reaction to that event. Okay, so this definition, it is a direct question. This kind of definition is called as what? Crisis intervention. Okay, by knowing the patient reaction, you are going to identify the solution for that. So this is called as what? Crisis intervention. Okay, so here there is a stressful event and the patient reaction you are analyzing and you are making some intervention. This is called as what? Crisis intervention. And the next one is a direct and very easy question. The normal potassium level in the blood for adult 3.5 to 5 milliequals, that is option C is the right one. Always milliequals per liter. Sodium, potassium, it will be coming in milliequals per liter. Okay, so that term also you have to remember. It is not milligram, it is milliequals per liter. Many students are making mistake. Even though they know the answer, they know the value 3.5 to 5, they know the value in numerical number, but what is coming after the value, there they are making a mistake. Whether it is milliequals per liter or milligram per liter, there they are creating the mistake. Okay, so always sodium potassium values, it will be there in milliequals per liter. That you have to remember. Next, question number 28. Before the nurse washes the hand when leaving an isolation room, underline the word isolation room. Okay, what is the last thing that she has to remove? And these are all the keywords you're supposed to see from this question. So the nurse washes the hand when leaving an isolation room. What is the last thing that is removed? So the nurse is going to wash the hand when leaving the isolation room. Okay, she is leaving the isolation room. Now she is supposed to wash the hand. What is the last thing that she has to remove before washing the hand? This is how you have to understand the question. And obviously it is an isolation room, so before leaving the room, the last thing what the nurse has to remove is mask. Okay, so the mask has to be removed. Once the mask is removed with the gloved hand, at last the glove will be removed and the hand washing should take place. Okay, fine. If the glove option is not here, so we are going for what? The mask has to be removed in the last and then hand washing has to be take place before leaving the isolation room. Okay, fine. And the next one is question number 29. To remove a glove that is contaminated, what should the nurse do first? So there is a contaminated glove. How the nurse should remove the gloves? Okay, this is the question. So here the right answer is option A, that is grasp the outside of the cuff or palm of the glove and pull it away from the hand without touching the wrist or the fingers. Okay, so this is the right one. Mostly the student will get confusion with the question, answer A and answer C. Okay, so answer C, what they are saying, pull the glove off the back of the hand until it slides off the entire hand and discard it. Actually, this technique is totally wrong. That's why we have to remove this option. Pulling the glove, while you are pulling the glove, there is a chance for tearing of the gloves. Okay, there is a chance for breaking of the gloves. Okay, so pulling is not a right way of removing the glove. Instead, grasp the outside of the cuff. Cuff means the one which is there near to the wrist. So you have to grasp the cuff and then you have to remove or pull it away from the hand. Okay, so that is the right technique without touching the wrist or fingers. That's why we selected the option A. Okay. Question number 30. Which one of the following is the common condition that cause numbness, tingling, pain in the hand and forearm? It is very simple question. Whenever you come across the word, the keywords like numbness, tingling, pain in the hand and forearm, you have to think about what? Carpal tunnel syndrome, because if there is any compression over the medial nerve, the signs and symptoms of the compression of the medial nerve is numbness, tingling and pain in the hand or forearm. So the compression of the medial nerve, that condition is called as what? Carpal tunnel syndrome. Okay, so here the right answer is option A. And what is Bell's palsy? Bell's palsy means the seventh cranial nerve is getting affected, the facial nerve is getting affected. Okay, so ptosis will be there, drooling of the saliva will be there in the affected side. Okay, that is ipsilateral side. So those things are different. Okay, so this option we have to remove. Dystonia means muscle tone is affected here. Okay, so there is no related with the, it is not related with the question. Okay, so at last the right answer is option A, that is carpal tunnel syndrome. See, all the questions whatever they have asked is very simple. The night blindness is caused due to the deficiency of, question number 31. The night blindness is caused due to the deficiency of vitamin A. Okay, so it's very simple one. Which of the following vitamin is not fat soluble? For this you should know the fat soluble vitamin. Vitamin A, D, E and K are the fat soluble vitamin. A, D, E and K. These are all the fat soluble vitamin. Okay, so among these, what is not there here? A is there, D is there, K is there. So B is not the vitamin which is coming under fat soluble. So B is the right answer. Okay guys. The next one is question number 33. Which of the following is the most sensible indicator of changes in the neurological status? Here the keyword is most sensible indicator of changes in the neurological status. So the most sensitive indicator is consciousness. Okay, see, memory, pain, vascular flow. So vascular flow is obviously not. So pain, memory we can consider, but still if the conscious nerve is not there, how you will ask the memory of the patient, how you will assess the pain of the patient? Okay, so among these three, which is the most important one? Consciousness is the most important one. That's why we selected option A. Question number 34. Patient with bacterial meningitis demonstrate which of the following? Bacterial meningitis. Okay. Infection and inflammation of the meningeal layers like dura mater, arachnoid mater, pia mater. Okay. So, in case of bacterial meningitis, there are different types of meningitis. TB meningitis, fungus meningitis, viral meningitis, bacterial meningitis. In bacterial meningitis, what changes you will see in the CSF, because in all the options they have included CSF, right? So bacterial meningitis means the right answer is option A, that is decrease in the CSF glucose level. Decrease in the CSF glucose level. Why? The bacteria will utilize all the glucose content for its survival. So the glucose level is going to get reduced in case of bacterial meningitis. Question number 35. Transplenoidal approach is used in the excision of which of the following tumors? Transplenoidal. They are going to make a incision in the splenoid region and they will reach the pituitary. Usually transplenoidal surgery, it is done for the pituitary tumor, for hypophyseectomy, removal of the pituitary gland or the tumor which is there in the pituitary gland. Okay, so transplenoidal means it is an approach. Transnasal approach is there, transplenoidal approach is there. Transnasal approach means through the nose they will reach the pituitary glands. Transplenoidal means just they will make a incision below the upper lip and they will reach the pituitary gland. just below the hypothalamus. It is exactly located in the sella turcica. Okay, so this is the region where the pituitary gland, the master gland, is located. So if there is any tumor, the removal of the pituitary gland tumor, that procedure is called as hypophyseectomy. And the way they are reaching, they can reach through the craniotomy, means they will making the incision in the skull and they will reach the pituitary. Otherwise they will go through the transnasal way or trans splenoidal way. Okay, and here the right answer is obviously for removing the pituitary tumor. Right answer is option B. 36. Which of the following is an incorrect match? Incorrect match. Okay, so they have given the same like match the following. They have given options. So which is rightly matching, which is not matching rightly, they are asking here. Okay, and here the right answer is, let's see, what is dysphagia? Difficulty in swallowing, but here they have mentioned inability to speak. So here option A is the right one. Okay, what is dysphagia? Dysphagia means difficulty in swallowing. Odinosphagia means painful swallowing. Okay, so dysphagia, here what they are saying, inability to speak. Inability to speak means lack of speaking, means it is coming under what? Aphasia. Okay, and here also they have given aphasia, inability to communicate. Disability to communicate or difficulty in communication means, or difficulty in speaking means dysarthria. Okay, so these are all the different types of aphasias. Okay, fine. So hemiparesis means obviously weakness. Hemiplegia means paralysis. All these answers are right, and here which answer is wrong? That is dysphagia means difficulty in swallowing should be there, but here they have mentioned inability to speak. So option A is the right one. Option A is the incorrect match here. The next one is phenytoin, carbamazepine, valproate or drug classified under the category neuromuscular, anti-epileptic, antidepressant, antipsychotic. So you all know that phenytoin, carbamazepine and sodium valproate, these are all the common drug of choice for what? Anti-epileptic, epilepsy drugs. Option B is the right one. Cholinergic crisis occurs because of over medication of which of the following condition? Cholinergic crisis. You know, acetylcholine and cholinesterase both are opposite to each other. So in which condition there is a problem with the acetylcholine? Here you have to think about myasthenia gravis. What is that? Myasthenia gravis. So what is happening in the myasthenia gravis? See, this is the neuromuscular junction. This is the neuromuscular junction. Here receptors will be present. Okay, so here this is acetylcholine. Usually the acetylcholine should sit over the acetylcholine receptors. After that, movements of the body will take place. Okay, so this is the normal phenomena. And the acetylcholine, it is controlled by acetylcholinesterase. Excess amount of acetylcholine is there, means it will be controlled by acetylcholinesterase. That is different concept. Here what you supposed to think is, in this question, cholinergic crisis, that is acetylcholine is crisis, or the function of the acetylcholine is decreased in which condition? This is the question, and here the right answer is myasthenia gravis. Myasthenia gravis, what is happening? Autoimmune antibodies are formed, and that autoimmune antibodies is going to sit over the receptors of the acetylcholine. All the acetylcholine receptors are covered by the autoimmune antibodies, so acetylcholine cannot reach the acetylcholine receptors. At last what will take place? The movement is not at all taking place. What are the classical manifestation of myasthenia gravis? Ptosis will be there, that is drooping of the eyelid. Also diplopia, double vision is also there. There are many other manifestation, but still most important classical manifestation is ptosis and double vision. Why it is happening? It is because of what? Autoimmune antibodies blocking the pathway of the acetylcholine. Okay, fine. So here the right answer is option A. And the question number 39. One of the primary nursing objective in the client with cerebrovascular accident is the maintenance of the airway. To achieve this objective, the nurse should initially place the client in the, so the patient is having cerebrovascular accident, CVA, otherwise called as stroke. So here in order to maintain the airway, what position you are supposed to give? Usually for maintaining a proper alveoli, you will be going for what? Semi-Fowler's or Fowler's position. That is 30 to 45 degrees semi-Fowler's, and 60 to 90 is a Fowler's. Okay, so here Fowler's option is not at all present. Other than Fowler's, many options they have given, like prone, lateral, supine, Trendelenburg. So among these, which position we have to give in order to maintain the patency of the airway? And here the right answer is lateral position. Why? To prevent aspiration of the salivary secretions or any kind of secretions. What position we normally give to the patient? Lateral position. So Fowler's position is not there, means we have to think in another aspect, that is to prevent the aspiration, which position we have to give? Lateral position. We cannot give prone position, supine position, Trendelenburg position. These three things are totally contraindicated. Okay, so in order to maintain the airway, we will be giving the Fowler's position. If Fowler's position option is not there, we can go for what? Lateral position. And question number 40, the client diagnosed with a atrial fibrillation has experienced a transient ischemic attack. What is the meaning of transient ischemic attack? Transient means for a temporary period of time. Ischemic attack means decreased blood flow to the brain. So which of the following medication would the nurse anticipate being ordered for the client at the discharge? So during discharge, what medication has to be ordered to the client if the patient is suffering from atrial fibrillation? So you have to think about that. What is the complication of atrial fibrillation? That is thrombus formation. Thrombus formation in the atrium, or in the in the atrium, what will be formed? Thrombus will be formed, and in long period of time that thrombus will get breakdown and it will become emboli, and it will travel in the blood vessels. It will block the small blood vessel. It will cause ischemic attack, transient ischemic attack. Okay, in order to prevent this kind of complications because of atrial fibrillation, what we supposed to do? We have to give what? Anticoagulant. So here the right answer is option A, that is oral anticoagulant medication has to be given to the patient. Option A is the right one. The next one, which of the following is the primary brain tumor? Okay, so here the right answer is glioma. Option B. This is the direct question. Okay, glioma, it is nothing but brain tumor, primary brain tumor. What are all the other options? Cerebral angioma, it is related to the blood vessels. There is abnormal blood vessels which is present in the brain. Okay, so that is cerebral angioma, so that is not a brain tumor. Fibroadenoma, it is a tumor, cancerous tumor which is present in the breast cancer tumor. It is called as what? Fibrous adenoma or fibroadenoma. So it is related to the breast cancer. Wilms tumor, it is the cancerous tumor of the kidney which is present in the kidney and most commonly seen in the children's above 3 years. Okay, so Wilms tumor, fibroadenoma, cerebral angioma, these are all the things we supposed to remove. And the remaining left one is glioma. So glioma is obviously a brain tumor and you have to make it as a right answer. 42. A CT scan of the head shows collection of blood between the skull and the dura mater. See how much simple question they have asked here. Which type of head injury does this finding suggest? There is a collection of blood or pooling of blood between the skull and dura mater. In between the skull and dura mater. Okay, so in this place is called as what? Epidural space. What is that? Epidural space. In between skull and dura mater, epidural. In between dura mater and arachnoid mater, subdural. In between arachnoid mater and pia mater, subarachnoid. Okay, so these are all the names given to the disease condition according to the location. And here what location they have mentioned? In between the skull and the dura mater. In between skull and dura mater. This is dura mater. So this is skull. So here what is present? Collection of blood is present. So this area is called as what? Epidural space. Understand? So here which is the right answer? Option C, that is epidural hematoma. Suppose there is a pooling of blood or collection of blood in between the dura mater and arachnoid mater. There is a collection of blood here. This condition is called a subdural hematoma. Or If there is a collection of blood between the arachnoid matter and pia matter, in between these two matter there is a collection of blood, it is called as what? Subarachnoid hemorrhage. Okay, so here in this question what they asked, between skull and dura matter, so this area is called as what? Epidural space. So epidural hematoma is the right answer. That's all. Question number 43, signs of increased intracranial pressure. Very simple question. Whenever you come across the word increased intracranial pressure, the signs and symptom is going to be just opposite to the shock. So what will happen in the shock? Either it is a hemorrhagic shock or anaphylactic shock, whatever it is. Okay, so shock and increase ICP. See, only one difference is going to be there. Okay, so what is that? In increase ICP, the pulse rate is going to be decrease. Okay, respiratory rate will be increase or irregular. Temperature is going to be increase. Blood pressure is going to be increase. So blood pressure, temperature, respiration, everything is increased. Which one is decreased? Pulse rate is decreased. In shock, what is happening? Only the pulse rate will increase. In order to maintain the compensation of the blood loss or fluid loss, the pulse rate will increase in the shock. All other things like respiratory rate, blood pressure, temperature, everything will get decrease. Okay, so these two things are just opposite. The manifestations are just opposite. So you can remember like this. Compare and contrast while you are studying, or study along with the rational, so that it will be so much useful for you. So here the right answer is, in case of increased intracranial pressure, what will happen? Pulse rate is going to be decreased or slow. Respiratory rate, temperature, blood pressure is going to get increased. So here the right answer is option C. Okay, temperature is increased, blood pressure is increased, and pulse is decreased. The nurse is assessing the client with tentative diagnosis of brain tumor. What would the nurse anticipate the client primary complication will be? Primary complication will be severe headache. Direct question. Okay, so where is that? Yes, recurrent headache will be there for the patient. Because of what? Increase in the intracranial pressure. In case of primary or brain tumor, the tumor, because of the increasing in the size of the brain tumor, what will happen? The intracranial pressure is going to get increased. If there is an increase in the intracranial pressure, the headache is going to be recurrent and severe. Question number 45. Temporary paralysis of the 7th cranial nerve that causes paralysis only of the affected side of face occurs in. So here the keywords you have to remember. Paralysis caused by the 7th cranial nerve. What is the 7th cranial nerves? It is a facial nerve. There are 12 pairs of cranial nerves. What are all they? Olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory nerve, and hypoglossal nerve. So these are all the 12 pair of cranial nerve. This is the sequence, exact sequence. So in this, the 7th one is facial nerve. If the facial nerve is affected, it will cause what? Facial nerve is responsible for what? Anterior 2/3 of the taste sensation. The first golden point is anterior 2/3 of the face taste sensation. Taste sensation is responsible for the facial nerve, and also the facial expressions is also controlled by the facial nerve, 7th cranial nerve. If the 7th cranial nerve is affected, what will the disease condition called as? That is Bell's palsy. So what will happen here? Bell's palsy will take place. So the right answer here is option A, Bell's palsy. Okay, what are all the other options? Trigeminal neuralgia means severe pain which is caused by the trigeminal nerve. Trigeminal nerve is the largest nerve, largest cranial nerve. Okay, and longest cranial nerve is vagus nerve. Longest nerve, vagus. Cranial nerve. I am talking about cranial nerve. Okay, longest cranial nerve is vagus. Largest cranial nerve is trigeminal nerve, and trigeminal nerve there is a problem, means it will cause what? Trigeminal neuralgia. And multiple sclerosis, it is a type 4 hypersensitivity reaction. It is also a autoimmune antibody reaction. Okay, where there is a damage of the axons will take place, degeneration will take place. Okay, so this condition is totally different. Myelitis is inflammation of the myelin sheath. And here the right answer is option A, that is Bell's palsy. And the next one is the correct angle for head of the bed elevation in ventilated patient to decrease respiratory complication. See, the ventilated patient means the patient is connected to the ventilator. So we have to give what? We have to elevate the bed up to 30 to 45 degree. 30 to 45 degree only. Okay, so 90 degree is high Fowler's and 45 to 60 is semi Fowler's and 30 to 45 is low Fowler's position. Okay, which layer encloses the walls of the heart? So walls of the heart means what? Tricuspid, bicuspid, semilunar valves. These are all the walls which is present in the heart. And which is covering these walls? Endocardium. Endocardium is the innermost layer and it is covering the walls of the heart. And here the right answer is what? Option D, that is endocardium. The next one is, which two walls of the heart open during the ventricular contraction of the heart? Okay, see, ventricular contraction. See, tricuspid, bicuspid is the one which will open during the atrium contraction. Okay, atrium contraction. So this is the heart. This is the heart. Tricuspid and bicuspid valves are present here. Okay, during atrium contraction, this tricuspid and bicuspid valve will get contract and it will allow the blood to go to the ventricles. And when the ventricles are contracting, the tricuspid and bicuspid valve will closed. Tricuspid, bicuspid valve will closed. And which valve will open? Pulmonary artery and aortic valve. Pulmonary artery valve, it is when the ventricles are contracting, this is ventricle. The ventricles are contracting, the blood will go to the lungs through the pulmonary artery. This is the pulmonary artery. Okay, and also the blood will go to all parts of the body through the aorta. Okay, so which valve will open during the ventricular contraction is pulmonic and aortic valve. This is the pulmonic valve and this is the aortic valve. These two valves will get open. So here the right answer is option B. The amount of resistance of ejection of blood from the ventricles. See, amount of stretching. If you are seeing the words amount of stretching of the ventricles for filling of the blood, if you are seeing these kind of keywords, amount of stretching, that stretching word is there, means that is preload. Okay, but here what they are asking, amount of resistance to ejection of blood from the ventricle. Resistance, if you are seeing the word, means the right answer is afterload. Stretching, preload. Resistance, afterload. So here the right answer is option C, that is afterload. Okay. And the question is, 50th question is, which of the following blood vessel has two major branches, that is circumflex artery and anterior descending artery? And here the right answer is left coronary artery. What is that? Left coronary artery, because the left coronary artery, it gives rise to the circumflex artery and anterior descending artery. Okay, so here the right answer is what? Option D. So rest of the questions we'll be discussing in the next session. Fine, in part C. So hope this video will be so much useful for you. So if you want to watch the same kind of videos, please support our channel, motivate us by supporting us. If you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon. Share this video as much as possible so that everyone will get benefited from this. Thank you very much, guys.